Hey everyone, good day to all. Myself is Ajay Moria. So guys, I'm going to continue our discussion of one to high yield 150 plus show short for the Fmge. So I am a little bit busy in my internship, so that's why it's going to be delayed. So this is going to be part eight of our discussion. Okay, so I think we are done until page 103. I think so. So let's go to there 103. Wait. Okay. Okay, yes. 103, I think. Okay. So guys, for the PDF link in the description, please take note. You just join our Telegram group and you can find the PDF there. So we're done until 103. Okay, yeah, where okay, yes. Okay. From here. So guys, we are going to discuss about the types of leukemia. So guys, I don't want to waste your time. So I will just tell how they are going to ask the questions in the exam. Okay, I will explain only the exam point of view only. Okay, now see guys, these are the leukemias. Okay, so guys, first of all you have to remember there is only one image in the overall all leukemias. They are going to focus more. That is these are merged cells, or these are smudge cells seen in the CLL. Okay, CLL. Next one, this is a question already. And remember, see, by seeing the age, you have to mark the answer. Okay, if they ask if they mention the child, okay, 10 years or 15 years old, okay, then you mark the answer is the most common in child it is the ALL. Okay, ALL. In the middle age it is the 40 to 45 60. Mark the answer as the CML. Okay, elderly patient, how much amma CLL. Elderly patient, just try to see the age given in the question. Okay, and next one, listen carefully. Other they are going to mainly focus on the CML. They are going to focus mainly on the CML. Okay, CML. Okay, see, in CML, what you have to look in the question, there will be basophilia. What is there is a more basophils, and there is a by what chromosome, it is a chromosome T, what translocation of what 922, and there is a what gene is the ABL BCR, ABL BCR, ABL BCR. Okay, there you will see here we will see the garden party appearance. It means all the values are going to be increased. Okay, mainly basophilia. Okay, this is the most important one. This is the one they are going to ask in the exam. From the AML, they will ask you what type of AML is most common. It is the AML type 2. Okay, they will also tell you what type of AML it is, DIC. What type of ML is AML is DIC. It is a AML type 3. AML type 3, also called as acute promyelocytic leukemia. We will see the maximum RR. So guys, if they are, see these are the RRs here, okay, mostly they are going to give the images. You have to see if there is a RRs or not. Okay, RRs are there or not. There are RRs. Okay, this is what they are going to ask the questions. Then, okay, they are going to ask you what the treatment for the AML type 3 is the trans-retinoic acid. That's it. From the ALL, I think I told already, most common in the childhood. Most common in the childhood. It is associated with what syndrome? Associated with the Down syndrome. Down syndrome. Down syndrome. Okay, na? Damgaru. Good night. So, okay, na? Yeah, important. That's it, for this small cell CLL. Okay, just at least remember this, okay, and remember the treatment for the CML it is the imatinib. Imatinib also is for the GIST syndrome. Okay, GIST. That's it from the CML leukemias. That's what they are going to focus more. Okay, you have to read that one. Okay, next one, coming to the disaster management here. See, you have first of all you have to know about the disaster cycle. First one is this is the disaster impact. Next is RRR, response, rehabilitation, reconstruction. Response, rehabilitation, reconstruction, mitigation, and preparedness, and the disaster. See, IRRR. Okay. Response, secure. Tell me, disaster impact, response, rehabilitation, reconstruction, mitigation, preparedness. This is the cycle you have to remember. Remember here, okay, na, disaster cycle here. Okay, na, recovery means what? Rehabilitation and reconstruction. Risk reduction phase is the waterma, mitigation and the preparedness. Means we have to prepare for the upcoming disaster. Okay. Yeah, this is how they are going to ask the questions. Remember here, the most commonly reported disease in post disaster is the gastroenteritis. Micronutrient deficiency is the vitamin A. Okay, due to what? Deficiency of relief diets, measles, and diarrhea. Okay, na, causing the gastroenteritis. Okay, na, the most common micronutrient deficiency is the vitamin A. Only vaccine given is tetanus toxide. Next one is the triage system. These are usually in the what? In the bomb blast situation, in the emergency, like the bomb blasting situations. So we have to prioritize. So we have to prioritize the patients according to their what according to their needs, requirements. So here the patient, see, we have in the red, yellow, green, black colors. Red, yellow, black trash system. So it is used in the emergency situation, like any bomb blasting or any case scenarios and accident scenarios. So we have to, if the patient required immediate resuscitation or limb or life-saving surgery in the next 6 hours, then you have to give the highest priority is the red. Possible resuscitation or limb life-saving surgery in next 24 hours. You have to put it in the keep the patient in the yellow zone. Minor illness ambulatory patient, you have to put them in green zone. Black means already dead or about to die patient. You have to put in the black. This is the least bad. Highest priority is the red. Least bad is the black. Okay. The next one, see here. These are, I think you guys know about this one, waste disposal here, yellow, red, and white and blue. From yellow, we are human, animal, anatomical waste, soiled waste, expired medicines you have to keep here, chemical waste, body fluid, clinical waste you have to keep in the yellow, contaminated waste, recyclable, plastic bags, bottles, pipes, container, catheters you have to keep in the red one, scalpel blades, saw edges, okay, na, scalpel blades, needles, syringes with a fixed needle, you have to keep in the Verama, in the white, okay, sharp metals. See, B for blue, B for broken. Okay, broken glassware, cytotoxic waste, metallic body implants, contaminated glass, including medical wells. Also, you have to destroy put in the blue. This is what you have to remember. Okay. Next one, this is the factory actor. This is the factory. What you have to remember is this is the work related norms. Employment of young persons. See, employment prohibited for age less than what? Less than 14 years. Okay, now must be, if children is less than age 14, then you have to not do in the child labor. Okay, it will come under child labor. So for the employment, age must be more than 14 years. 15 to 18 years, adolescents should declare fit by certifying surgeons will work only between 6 a.m. to 7 p.m. only. Okay, na? 6 a.m. to 7 p.m. only. And guys, a maximum 4.5 works per day for the adolescent. How much? 4.5 works per day for adolescent. But per week, how much? Per week, how much? 48 hours per 48 hours per week, and maximum is the 60 hours per week, include the overtime. This is the this is the what they are going to ask in the question. Maximum hours per week, including overtime, it is 60 hours, but maximum hours per week, for the 9 hours per day, it will be 48 hours. Okay, this is what they are going to ask the questions in the exam. No, to remember this one, but these are most important. From the vaccines, they're going to give the one MCQ. First of all, you have to know about the which is the killed one, which is the live attenuated. Okay, which is the live actions. So, guys, for the live vaccines, yeah, this is a mnemonic. Rome is the best place to go at. So, rubella, rotavirus, or a polio vaccine, measles, epidemic, typhus, influenza, mumps, BCG, plague, typhoid, water vaccine, and the yellow fever. So, guys, remember, I think you have your own mnemonic for for remembering the live actions. You can just remember your own type, your own mnemonic in your own way, in your own mnemonic. Okay. So guys, for this one, this is the live vaccines. Okay. And killed one, guys, killed what killed is typhoid, cholera, plagues, pertussis, IPV, rabies, and Japanese encephalitis. Toxidra. Okay. Da dot C dot dat 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 diphtheria anthrax tetanus is the dot the toxide. Toxide is automa dot. Toxide dot means what? DAT. D means diphtheria anthrax tetanus. Polysaccharide recombinant is the HPV. Okay, na? That's the virus. See, mostly they are going to ask you questions about the recombinant one. This is important. Just remember these, or remember this only one. Better to remember these remember this one. Automatically you can rule in rule out. Okay, but most probably they're going to ask the recombinant. Okay, I think everyone knows about this one. At birth, for 6 weeks, what you are going to at birth, what vaccines are? BCG, oral zero, oral polio vaccine, and Hep B vaccine. Okay, na? Zero dose. What mostly BCG, OPV, and hepatitis B we are going to give at the birth for the 6 weeks, 10 weeks, 14 weeks, 9 months. Just remember this table, guys. Okay, but mostly they are not going to ask the question from here. But the most important one is the at the birth what vaccines are they are going to give. And I told that vitamin A, how much vitamin A you have to give for the 1 year child, 2 year child. I already discussed in the previous videos. Okay. And apart from this, guys, this is the most important one. Right? Remember this one, BCG. What are the side effects of BCG? It is it causes ulceration, supportive lymphadenitis, osteomyelitis, disseminated TB, and remember, right? It is it diluted in the normal saline. Okay, DPT. The side effect is the waterma. Side effect is the neurological, and this shock. That's why if the patient is having seizures, you have to not give the DPT. For measles, it causes the toxic shock syndrome. Okay, usage of vaccine while open more than 4 hours, then it causes the toxic shock syndrome. Okay, na? And it is dilute is the sterile water. Remember, measles, just reverse it or it will become double. It means what? Water. It means distilled water. Okay, remember here, maximum chance of cold chain failure at the seen in the sub-center and the village level. All live vaccines are containing pregnancy except is the yellow fever. Okay, done. Remember what? Also remember some strains here, guys. For BCG, B Dhanus. Okay, the B Dhanus means BCG Danish. I'll tell the important one. Remember that one. Okay. Remember the measles, mumps, rabies, rubella, and these are important ones. Okay, na? Measles are very important at most. Mumps, what? My geril, mum, mum jerry, mum jerry. Okay, mom jerry, mumps, geril, lin stain, rubella, R-R-A, rubella, starting R, ending A. So that is the RA, rubella, RA27, 3 stain. Okay, remember this one. I will explain this one in the upcoming videos. Okay. Remember this one, Ra. This is very important one. So coming to the CGD, chronic granulomatous diseases, Ra. They ask this question 2 times continuously, 2 times. Okay, what is the defect? Defect is the NADPH oxidase deficiency. So they're going to give that. They're going to give a long case, and they will at the ending they're going to tell that we did the screening test NBT. We did the screening test. We did the screen test is the NBT. Okay, NBT. So you have to know that when you have to do the NBT test, that is in the CGD, in the chronic granulomatous disease, we will do the NBT. Or else they will mention that they will give a large cases, and they will mention that we did the DHR test. Okay, that means dihydramine test we did. It means you have to know that. So we have to know they are asking about the chronic granulomatous diseases. Okay, okay, now. So here, guys, you can see they will ask you also about the which is the enzyme responsible for the respiratory burst. For the respiratory burst, it is the NADPH. It is the NADPH. Okay, now see how they are going to ask the questions. They are going to they're just going to give the we did the NBT nitrobutylene test. I think okay, nitrobutylene test. It's in there. Okay, now how they are going to ask the question. They will give one big question and they will mention that we did NBT test is positive or else DHA test is positive. That means that they are talking about the chronic granulomatous. Okay. They also ask you about which this is the chronic granulomatous diseases. Which enzyme is responsible for the respiratory burst? It is the NADPH oxidase. Okay. Remember this one. Next one, this is the next one. This is the Bruton's hypogamma globinemia. This is the how they are going to ask question. First of all, straightforward. Bruton's Bruton's hypo hypogamma globinemia is a type of is a defect in what under it is in the defect in the opsin. What about cardiac Haggerty defect? It is a defect in the what? Defect in the phago. Defect in the phagocytosis. Okay, na? It is defect in the phagocytosis. Okay, na? See here, what happened here is the Bruton's hypogammaglobulinemia. It means there is a there is a completely defect of the B cell. Okay, na? There is a completely defect of the B cells. If there is no B cells, then what happened, Amma? Then there is no immunoglobulins, there is no antibodies, there is no antibodies formation. That's why there is going to be serious infections. Okay, now as you seen in the XLR means seen mostly boys. Okay, there is no production of globulins. It is seen in the BTK gene defect. Okay, BTK gene defect. That's why that the patient is always having the severe recurrent infections. Next is the cardiac syndrome. This is the defect in what? Defect in the phagocytosis. Defect in the phagocytosis. Defect is the where in the gene called list gene. They will show you the image as the CC. They will mention in the question that the patient is having the CNS abnormality, anything. They will mention hemorrhage and the decreased immunity, and there is albinism. Okay, they will see the albinism also. Okay, I think you know albinism. So these are the characters they are going to mention. They are going to mention in the exam. Okay, there is a silvery hair also. Okay, silvery hair. Okay, so this is the lad one, lad two, lad one, lad two. Okay, just remember this one. They will give the history as the umbilical cord stamp, but shedding delayed. It is in the lad one, lad two is the Bombay blood group. What defect is the salile liver sex. Okay, next remember from the SLE. What is the important? The most sensitive test is the what ANA antinuclear antibody. Most specific is the ASA. See, sensitive is Anna. Anna means what, Amma? Anna means bhai. So, my Anna is very sensitive. Anna is very sensitive. Anna, sensitive, specific. Asa. Asa is a specific. Okay. So, okay, na? Both sensitive and specific is the anti-dsDNA. And you know, lupus, anti-Ro antibody. SLE with psychosis, anti-Arabagel PP bodies. Remember, from this one, from this syndrome, and there is a heart-related disease. More often, it causes the mitral valve collapse, Down syndrome, endocardial cushion defect. For Towson Edward, we had a patent PDA, Klinefelter, mitral valve prolapse. Turner syndrome, we'll see the heart defect is the bicuspid aortic valve. Remember from here, hemophilia A, hemophilia B. Hemophilia B is also called as Kismet disease. Deficiency ra hemophilia A8, A8, B9. Okay, B9. C ra, how are you going to remember? See, this is the B9. See, this is the B9. Okay, na? Just remember B9. Okay, B what am I 9? Okay, so hemophilia B9, B9. Okay, B9. Okay, B9. B is the 9. Okay, so remember here the PT is all normal here. APT also increases here. But remember the treatment for this one, this is the remember only the change the deficiency. A is the 8, B for B9, and the treatment will be the cardio precipitate here, and the, for here the fresh frozen plasma is the treatment for the hemophilia B. Okay, done. Nasira, these are the types of what hypersensitivity reactions here. From these guys, the most very famous one is the I think everyone knows about this one. Type one is for the waterma allergies. Okay, I think everyone knows about allergies, but they are not going to ask the question from the type one because everyone knows that one. Okay, that's why they will focus on the type two. Okay, type 2. Okay, so guys, remember here, type 2. See, this is the, remember the mnemonic is the my blood group is RH positive. Remember, myasthenia gravis, blood transfusion reaction, good pass syndrome, Graves' disease, RS incompatibility, and rheumatic heart disease. Yeah, remember, one thing remember, guys, here. One thing remember, guys, here. Myasthenia gravis is a type of what, amma, is a, in the examination, if they mention type 5, for the myasthenia gravis, if there is options 1, 2, 3, 4, 5. Then what you are going to mark the answer? You have to choose 5. Okay, choose 5. Choose first. You have to choose 5, then 2. Okay, in the exam, you have to first choose the 5, then choose the uh, 2. Okay, remember here type 3 reaction SLE, serum sickness, sick test for converted by diphtheria. Here, here HSP here, reactive arthritis. Okay, and the type 4 are this, they are going to be delayed tests. These are delayed tests. Like example, contact dermatitis. This is important. Okay, contact dermatitis is important from the contact dermatitis. Skin test, these are important from the type 4 hypersensitivity reaction. And remember, rheumatoid arthritis is both type 3 and type 4 hypersensitivity. And SLE is also type 2 and type 3. Okay, transplant hyperacute type 2, acute type 2 and 4, chronic type 4. Okay, just I will mark the important one. Okay, just remember this one. Okay, very very important. From this one, this is acute. I think everyone knows about this one. This is the inflammatory part. There is a injury, inflammation processes. Okay, na. So this is the cellular event we have in the mnemonic is the Marat cop. Marat cop. For the acute inflammation, what is the earliest event happen is the first of all, whenever there is a cut, there is going to be what, there is going to be the vasoconstriction. This is vasoconstriction. This is a transient, or this is the earliest. We see the earliest one. Earliestly, this is going to happen. Next one, what, next one is the vasodilation by histamines. This is going to permanent. Next one, the increase permeability. Okay, what is the hallmark of the acute inflammatory inflammation? Is the what is the increased permeability? The increased permeability is the hallmark. Earliest is the vasoconstriction. Okay, cellular events are remember Ratkop. Remember the order. Okay, M for migration, rolling, adhesion, transmigration, or diaperesis, chemotaxis, and opsonization. Remember the mnemonic is a Maratkop. You have to remember the order. Apart from this one, guys, remember this one migration. Rolling occurs with what, Rolling is occurs with the selectins. Rolling occurs with the selectins. Adhesion by what? Integrins, CAM, VCAM, and ICAM. Transmigration of the neutrophils is called as what? It is called a diapids. It is called diapids. Sometimes they're not going to give the transmigration. They are going to give they are going to give the option as that diapids. It means you have to know this is called like the transmigration. Okay. C for chemotaxis. This is the only the unidirectional. Okay, na antigen is directed towards the neutrophils with the chemotaxis molecule. This is called as what? Exogenous bacterial products and antigens by leukotriene B4, interleukin 8, and C5a complement protein. Next, opsonization. What is the purpose for the opsonization? It is the purpose is to make antigen test here to the neutrophils. Okay, na? Because we the opsonin, it is the what? C3b. It will make the antigen what? Test here. Okay. Opsonization is C3b. P for phagocytosis. This is what you have to learn in the cellular events. Next one is the dystrophic calcification and the metastatic calcification. Remember here how they are going to ask in the exams. Dystrophic calcification, the serum calcium level are normal. In metastatic calcification, serum calcium is increases. Normal increases. Okay, and then you have to remember the you have to remember the what? You have to remember the examples, ra. Okay, in the metastatic calcification, ra, CKD, Pyqs disease of bone, hyperparathyroidism, sarcoidosis, vitamin D intoxication, and hypercalcemia. Here comes under the metastatic calcification. Okay, okay, na done. So these are all comes under the metastatic, and these are comes under the dystrophic. This is how they are going to ask the question. This is the question already in the July 2024 Fmge exam. Okay. Next one is the apoptosis versus necrosis. What is apoptosis? It is like a hanging case. It is like a hanging case. There is no inflammation. There is a programmed cell death. There is no damage to the cell membrane. Hanging. Okay, hanging, done. There is no inflammation, nothing, no damage to cell membrane. Most important enzyme is the caspase. Intrinsic is the CG intrinsic caspase 9. C in 9 in means 9 ra. Okay, caspase 9. Extrinsic 8. Remember, necrosis is like a murder. Necrosis is like a murder. There is a inflammation, mediators, there is membrane damage. Okay, necrosis is a murder. Hepatosis is a what? Padama. It's a hanging. Next what? Reversible versus irreversible cell injury. For the reversible injury, the hallmark is that there is a blebbing. There is what? There is a blebbing. First of all, there is a blebbing of the cell membrane. Next one, there is swelling of the endoplasmic reticulum and the mitochondria. Nucleus is always intact here. Myelin fibers are present. No amorphous densities are seen here. There is no leakage of cellular contents. There is no inflammation in the reversible cell injury. Coming to the irreversible cell injury, there is a breakdown of what? Cellular membrane, breakdown of endoplasmic reticulum and the mitochondria. Remember here, how DNA is going to destroy here. First of all, there is going to be the pycnosis, then karyoxesis, then carolysis. Lysis means what? Death. Okay, now first of all, it is the pycnosis, then karyoxesis, then it's going to be the carolysis. This is what you have to remember in the irreversible and the cell reversible versus irreversible cell injury. Okay, now they'll give the one points from there. This is what you have to know. No inflammation in the reversible cell injury. No leakage also, but here is a leakage of cellular contents. Okay. There is amorphous densities are present in the mitochondria. It is seen in the irreversible cell injury. Okay, now this is what they are going to ask in the exams. Next up, Burkitt's lymphoma. Sira, this is first of all how we are going to catch the points. If they give what this is looks like what starry sky. This is the starry This is a stary sky appearance. It's the Burkitt's lymphoma. Remember here, Burkitt's. This is the Burkitt's. It B is look like what amma 8. Remember it like 8. Okay, na? B is look like 8. So it is what amma 8 plus 14. Okay, na? Okay. Remember the 8 at 14. Remember 8 at 14. Okay, na? It is the translocation of what amma 8 comma 14. Okay, 8 comma 14. This is the Burkitt lymphoma. They will give the image also. So, okay, for Burkitt lymphoma, remember you have to always see the question. They mention the translocation of what chromosome? T translocation of T14. See B for remember 814. Okay, na? The best test is the what? Flow cytometry, bone marrow biopsy. So Salah to do the by using Salah needle. Okay, na? It is associated with what amma? Epstein-Barr virus. Okay, na? Remember here. Remember multiple myeloma. First of all, you have to remember they will start with the history as the history start with the elderly patient with low back pain. Okay, na? Elderly patient with low back pain. Okay, now elderly patient with low back pain. It means they are asking about the multiple myeloma. Okay, now see first of all you have to check the chromosome. They are asking about the myeloma. See myeloma ravatama multiple myeloma 11 here. See myeloma 11. It is the 11. 11 means what amma is 11 and 14. Okay, see, 14 is always constant here. 8 and 14, here 11 and 14. See, myeloma, 11 and 14. See, this is the crab. Crab means what? There is always there in the question they are going to give as this is the calcium is always increased and there is renal insufficiency and a patient might be anemic and there is a bony lactic lesion. There is a bony lactic lesion. Okay, punched out lesion here. That's all for the multiple myeloma to do the what diagnosis. So we want just 1 mark. Okay, there is also there is a mod cells with the Russell bodies. Okay, Russell bodies are seen in where in the multiple myeloma. See Rassam what Rassam see Russell muscle. Do you know the Andy Russell? He is having more muscle. The Russell muscle. Russell muscle means what? Muscle. Multiple myeloma means what? Russell. Okay. They also see the and also remember red blood cells shows a stack of coin appearance. Red blood cells shows a stack of coin formation known as the watermark, known as the Rowlex formation. Remember what is the called as the Rowlex formation. Okay. Okay now. So done. Most commonly, we'll see the IgG spike. That also increases here in the multiple myeloma. Okay, na? Just remember the tricks how you are going to solve the questions. These are the tumor markers that you have to study about the tumor markers. Okay, read these tumor markers. It's your time to read. Next one is the gas. Next one is the gist here, gastrointestinal tumor, stomach tumors. Remember here the genes responsible are for gist is there is question that genes for the gist are KIT, PDF, GR, STH, BROF, and the most commonly and is the most commonly what? Most commonly mesenchymal GIT tumor. What it is the most commonly mesenchymal GIT tumor. This is the one MCQ. And next one is it is the hematogen spread by hematogenous agent from what? Agent from the Kajal cells. Okay, these are the pacemaker of the GIT. These are agent from Kajal cells, Kahal cells. Okay, and these are most commonly from the mesenchymal GIT tumor. Presentation is the upper GI hemorrhage, mass, pain, and perforation. Investigation choice CET abdomen. Biopsy is not recommended because it might cause the severe bleeding. Treatment mainstay is the surgical resection with 2 centimeter margins, malignant resection. Treatment is what tyrosine kinase inhibitor is the imatinib. This is also for the CML. Remember from the lung and the thyroid cancer. Coming to the thyroid cancer here, coming to the thyroid cancer here. First of all, you have to know about this one. These two are okay. These three cancers are very important. See, see all the thyroid cancers are going to originate from the follicle cells. Okay, from the follicle cells. But there is one muddy fellow, that is medullary. That there is a medullary fellow. Okay, now this guy is going to originate from the parafollicular cells. Parafollicular cells, C cells. Okay, okay, all are originated from the follicle cells. But this guy is going to originate from the parafollicular cells. Okay, remember what you what is the what is the function of parafollicular cells? It having the C cells, which causes the what is the job of the parafollicular cells? It causes the increase in the water mark calcitonin. Okay, now that's why if there is a changes in the water in the parafollicular cells, then it's going to increase the calcitonin. It is going to increase the calcitonin levels. Okay, remember see here ret 10 men. Okay, see med ret 10 men. Yes, ret 10 med men. Ret 10 med men. Okay, it is what a means. See, these are all genes ret 10. These are related to the medullary thyroid carcinoma, and also men 2A and 2B also related to the medullary carcinoma. Thyroid carcinoma. Okay, acrylamide is the for the okay. Amylide is the what? Acrylamide. Remember this one. Next one is the follicular cells. Remember, it is not diagnosed in the FNSC. Follicular will not follow by what? FNSC. Okay, by doing FNSC, we can't diagnose the follicular cells. Follicular thyroid carcinoma. This is the C. FRAS. 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 This is the RAS mutation. This is going to be what? It's going to be the hematogenous spread. Hematogenous spread, and there is a capsular invasion. Mostly they are going to ask you questions about that one. Follicular cells, they are what mutation? RAS mutation. Not diagnosed in the FNC is the what? Follicular cells. That's it. Next one is the papillary. I think the most common, I know papillary, 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 papillary. Papillary means what? Popular. Most common. This is the popular thyroid carcinoma is the most common. BRAF and V600E. V600E. This is the genetic changes in the papillary thyroid carcinoma. Here they will mention the history as the history of radiation exposure, orphan eye appearance. Orphan is there. This is the orphan eye appearance. This is a cartoon network. There is a dystrophic aspect. I already told about the dystrophic and the metastatic. Yeah, this is the and the papillary thyroid carcinoma comes under the dystrophic calcification. Okay, so we will see the sum of bodies. What is sum of bodies? Sum of bodies are the dystrophic calcifications. Is called sum of bodies. Sum of bodies are also seen in the where papillary thyroid carcinoma. So remember that this is a PSM whole square. PSM whole square. Okay. This is the what? These are all comes under P, papillary thyroid carcinoma, papillary serous carcinoma. S for what? Serous. See, remember this one. Schwannoma, meningioma, mesothelioma. Remember for management of thyroid carcinoma, cancer for lobectomy, for the small well differentiated tumors. Total thyroidectomy is the main standard treatment for most cancer. Remember, it is a total thyroidectomy. Always remember, if they mention any thyroid cancer, go with the total thyroidectomy. Coming to the lung cancer here, first of all, remember squamous cell carcinoma, adenocarcinoma, small cell carcinoma, large carcinoma. Remember here, S for the water, S for smoking. Yes, for smoking, it means squamous carcinoma, small cell carcinoma. These are all associated with the smoking. And also, guys, they are the present on the way, present centrally. Patient centrally, as for center means smoking and centrally. You know, if they are going to, if they are in the question, they are going to give the patient is a smoker and also the tumor is located at the center. It means you have to think about the squamous and the small cell carcinoma only. Okay. See, others are guys see this is the in the adenocarcinoma. Okay, na in the if they ask you guys, the patient is a non-smoker. Okay, if they ask you if they are in the question, they tell you that the patient is a non-smoker. It means the most common type of cancer seen in the non-smoker. It is the adenocarcinoma. It is the adenocarcinoma in the non-smoker. Read the question carefully. Okay, na? We will see here the keratin pulse. The keratin pulse in the squamous cell carcinoma. Okay, na? Gene is the p53 gene. Here, adenocarcinoma has EGFR1 mutation. You'll see. In the small cell carcinoma, you'll see the ajoparity effect. And this is the also called as oat cell carcinoma. Okay, na? Small cell carcinoma, it is also called as oat cell carcinoma. Okay, na? Large cell nothing. Okay, large cell don't know it. Remember. Okay, na? Just remember this one, the important one. Okay, mostly they mention the. Please try to look the read the questions carefully. How they are going to how they are asking the questions. Smoker, non-smoker. Okay, na? Center or periphery. Cadmium or crash EGFR mutation are there. What cell carcinoma. Okay, that's how you have to solve the questions. Next one is sleep apnea, obstructive sleep apnea, central sleep apnea, obesity. Okay, na? I think everyone will mark the answers. The obesity, hypoventilation syndrome. Obviously, there's going to be what? Obesity. BMI more than 30. Okay, simple. Sleep apnea, and also remember here one thing impaired with the with the obesity. Okay, next one is obstructive sleep apnea and the obesity, hypoventilation syndrome. These two guys are associated with what obesity. So guys, if they give the obesity, BMI more than 30, and also they mention that the patient is obese, then you have to not confuse with these two, obesity, hyperventilation, and the obstructive sleep apnea. You have to rule out the which one. For the obesity hypoventilation syndrome, also called as Pyqs syndrome. Okay, na? Obesity, how much BMI? More than 30. There is a list to hypoventilation. What? There is going to be increase in the partial CO during the working hours. Okay. That's why, guys, there is going to be the what? Decrease in the partial oxygen and increase in the partial pressure of the what? CO2 during the sleep. That's why there is going to be what? Hypoventilation. The treatment is the what, amma? What? PPV, PPE, PPP, PAP, positive air pressure, and the weight loss, or the weight loss for the patient. Sleep apnea, there is a repeated what? Means what? Repeated session of breathing here for more than 30 seconds during sleep. Disrupted sleep daytime, and then there is a all the hence there is going to be the solve someone, that means the patient is always going to be sleepy. Okay, now. So yes, remember this study. Please study this one. Okay, they are the sleep disorders. You have to remember this one. Like from mostly, they're going to ask this one: obesity, hyperventilation syndrome, and the sleep apnea. Coming to the sarcoidosis, from only the exam point of view, remember there is a X-ray. What amma? There is a hilar adenopathy, hilar lymph node adenopathy, hilar and lymph adenopathy. For CT X-ray, it is the better one is the CT X-ray, which is the extensive hilar mediastinal adenopathy. Okay, na? X-ray will see the hilar lymph adenopathy, and there is a but on the CT we'll see the clearly that is called the what? Extensive hilar and mediastinal adenopathy. This is what you have to see in the question while solving the sarcoidosis. Is there is a lymph, there is a bilateral adenopathy or not. Okay. Okay, now done. Treatment will be the glucocorticoids. Okay. Remember, and also please try to remember here it is associated with the Bell's palsy. There is going to be the parotid enlargement. Granulomas, that is what type of granulomas are? These are the non-casseting. Okay. These are non-casseting granulomas. Okay, na? And also I think that's it to remember the sarcoidosis. Coming to the one, this is the pneumocystis cerevisiae. I think I already discussed about this one. Okay, discussed about this already. Okay, so please try to remember this one. I discussed this already in the previous slides, I think. Okay, remember from here that this is the brown sequence syndrome. This is the brown sequence syndrome. So how they are going to ask the questions? See, uh, they give that there is a what? There is a contralateral loss of dash, pain, temperature, and a crude touch. Okay. What? All are ipsilateral. Only what amma? What? Contralateral loss of temperature, and a crude touch below the lesion. Okay. Remember, this is very important. The brown circle syndrome. And remember, all are ipsilateral loss of all sensor level at the lesion. Ipsilateral loss of element signs, reflexive paralysis. Ipsilateral human sign below the level lesion. Just remember this only now, okay, na? There is a contralateral loss of the pain, temperature, and the crude touch. That's it from the brown sugar syndrome. Coming to the CNS tumors, CNS tumors are very important. Children will see the pilocytic astrocytoma. The most common, this is the most common. They'll ask you which is the most common primary brain tumor of the in the childhood. It is the pilocytic astrocytoma. One MCQ covered. Which brain tumor? Which brain tumor? Um, which brain tumor is associated with the microcyst and rosenthal fibers here? This is going to be the pilocytic astrocytoma only. Okay, na? And also that's it. See, one question. Pilocytic astrocytoma is the most common primary brain tumor of childhood. Okay, na? That is the what amma? Most common primary brain tumor. That is the benign tumor is the pilocytic cytoma. Pilocytic astrocytoma is the most common benign tumor. Remember, which is located at the periphery. At the periphery, okay, na? Periphery is the pilocytic astrocytoma. Remember here for the medulloblastoma is the most common malignant tumor, brain tumor of the childhood. Remember here, benign is the pilocytic, malignant is the medulloblastoma, which is located at the what? Centrally located. It is the centrally located is the medulloblastoma. Okay. Next one from the craniopharyngioma. This is the most common childhood supratentorial. It is a supratentorial tumor. Okay, na? This is the where there is a what calcification is most. Okay, na? Calcification is most. Okay, na? Remember how they are going to ask the question. Very simple. Okay, na? Remember here. What is the most common what is the most common benign brain tumor of the child? Which is located at the periphery. It is the what? Pilocytic astrocytoma. Most common malignant tumor, which is located centrally. It is the medulloblastoma. Okay. For the most common childhood supratentorial tumor, it is the which is where we will see the calcification. It is the what? Craniopharyngioma. That's it. Next, coming to the adults here, glioblastoma is the highly malignant tumor, is the most common one. Most common benign is the meningioma. Meningioma. Remember here, glioblastoma, most common, okay, malignant, and benign is the meningioma in the adult. It is found in the cerebral hemisphere. We'll see the butterfly glioma here. It is the butterfly glioma there is a serpentine necrosis. Okay, na? In the glioblastoma, which will see the serpentine necrosis, and there is a butterfly shaped glioma you see. Okay. Next one is the oligodendroglioma. We'll see the here what we'll see the fried egg appearance. The fried egg appearance. Fried egg appearance or else the chicken virus. See the this is also called as non-veg. Also called as non-veg tumor. This is the oligodendroglioma. Sira they are like egg. Okay, now that's the fried egg appearance seen in the oligodendroglioma. Next one is the next one is the meningioma, most commonly typically benign. It is they will ask you which are related to the progesterone. Okay, which are associated with the progesterone. It is the meningioma. Meningioma. And they will also ask you about the which brain tumor is associated with the tail sign. Tail sign. It means what? What? It's asking that having a dural attachment. Dural attachment. That is a tail sign. There is a tail sign which is the arachnid cell origin. Okay, now we will also see the some more bodies here. Okay, now remember here how they're going to ask the meningioma. There is first of all most common typically benign. There is a PR positive. The material progesterone here going to the positive here. Tail sign is here and some more bodies. I think everyone knows about the schwannoma. It is okay na. It is the also called as what amma? What? See schwannoma. She schwannoma. There is a mainly involves the what? Eighth cranial. It mainly involves the eighth cranial nerve. Okay, na? See, at what? At the cerebellopontine angle, it is a benign involving the cranial nerves 5, 7, 8. Mainly it involves the 8. Okay, na? See, often see, actually it involves the 5, 7, 8 also. But see, often it is localized towards cranial number 8 in internal gastric meatus. Vestibular schwannoma can present as a hearing loss and a what? Tinnitus. There is also what a bilateral vestibular schwannoma found in the where in the C. Schwannoma is associated with the NF1. Okay. No. Okay. Okay. See, schwannoma is associated with the type 2 neurofibromatosis. Type 1 is associated with what? Optic glioma. Okay, na? And also we'll see the here ice cream appearance and the varicose bodies and also you'll see the antennae A and antenna B hypocellular areas containing spindle cells. Remember here. Very important, rather. Very important. I may not discuss these very carefully, but you have to read this. Next one, NF1, NF2. I told you already that NF1 is associated with what, Amma? Associated with the what? Associated with the what here? Optic gliomas, list nodules. Okay, here. Two, what? Associated with the schwannoma. Okay. Okay. Remember this. These are the main important one. TBS, I already told you about this. When there is a seizure plus there is a CNS cinema. There is a CNS. Okay. CN, there is a what, Amma? CNS. CNS plus seizure. CNS plus seizure means what? There is a CNS symptoms and there is a seizure. It is the what, Amma? Tubular sclerosis complex. And remember, I will see the what type of leaf as leaf spots. Okay. Remember here, what is the treatment for this one? It is the vigabatrin. The vigabatrin. Vigabatrin is the treatment of choice for the tuberous sclerosis. Okay, na? The patient will have a seizure. Also, the CNS. Example, the patient is having the CNS means what? Here, tumor. Suppose a gene here. Okay, patient will have the mental. Okay, na? Patient will have the mental retardation. That is the intellectual disability. Okay, na? If you see the questions, the patient is having seizure and the what CNS complications. And remember here the We have the asleaf spots on the body. We'll see it is the tuberous sclerosis complex. It is the what ma multiple sclerosis. Multiple sclerosis. Okay, read this. Treatment with water, beta interferon, natalizumab, IV steroids, muscarinic antagonist, botulinum toxin, injections here. Okay, na? We have to see what are the ophthalmic findings, spinal cord findings, speech findings, neurological findings in the, and the other what inner findings in the multiple sclerosis here. Okay, which is the gold standard? It is the MRA. MRA is the gold standard for the multiple sclerosis. Okay. These are the LMS versus MMS. LS means lateral medullary syndrome versus medial medullary syndrome. Okay, na? See here, lateral medullary syndrome. This is also called as Wallenberg syndrome. But is also called as Wallenberg syndrome. Okay, na? I think during my internship in the general medicine, I saw this patient. I saw this patient of the lateral medullary syndrome, lateral medullary syndrome. Okay, now I think see here the patient will have the ipsilateral, that is going to be the wait luck. Okay, ipsilateral Horner syndrome, ipsilateral ataxia, dementia, dysphagia. Okay, this is the main important one. There is a dysphagia. Patient can't swallow. There is a portion of the portion of voice. There's a gag reflex for the 9, 10, 10 cranial nerves. It is also going to decrease. So this is the main important draw for the LMS findings. That is going to patient will have the dysphagia. Patient will have the what dysphagia. Okay, na? Vomiting, vertigo, nystagmus, decrease pain and temperature sensation from the contralateral body. Okay, na? Means opposite parts. Okay, na? From the patient affected here, there is a decrease, no pain, no temperature from the contralateral body. Ipsilateral, there is a one side is what? Horner syndrome. What is Horner syndrome? Anemia means what? Meiosis here. There is anhidrosis. Ipsilateral ataxia and a day and dysmetria. The patient will fall on the lesion side. Okay. That's why you have to tell the patient to do the what, ma? What is this? Finger and nose test like this one. Do like this. Yeah, no? Yeah, no? Very good. This is called the finger and nose. We are doing the cerebellum examination. Okay, na? See here, Watama. It is the most affect the Watama. Pyqs, posterior inferior cerebral artery. Okay, due to what? Due to there is a lesion on the posterior inferior cerebral artery, you get LMS syndrome. Okay, done. Remember this one. Next one is the medial medullary syndrome. Okay, na? According to me, guys, if you remember the LMS, then you can easily remember the MMS. Okay, remember the only one. Automatically you get the another one. Okay, done. Next one, this is a very important one. This is the radio sensitive tumor amount. This one, this is what is the most sensitive and the least sensitive. Most sensitive and the least sensitive. Remember here. This is very important. Oh my goodness, what happened to my slide here? Okay, done. A slide here. See how they're going to ask you the what. First question is the what is the most sensitive cell cycle phase? What is the most sensitive cell cycle phase? It is the G2M. G2 phase of the what M phase. What see M most sensitive M phase. G2M least sensitive. Yes, sensitive. Yes, least sensitive. Done. Okay, done. Next one is that which tumor is the most sensitive? Is the Ewing sarcoma. Least sensitive is the osteosarcoma. Organs are gonads are the most sensitive. Vagina are least sensitive. Blood cells are lymphocytes are most sensitive, and the platelets are what? Least sensitive. Remember sclera, and remember questions are always asking from the what a mass CNS. CNS is not a most sensitive, the least sensitive. Okay, na? Remember here. By heart this table, if you by heart this table, guys, you will get the one MCQ in your examination. Okay, now just keep one MCQ in your pocket right now. This one, raw metabolic acidosis. I think everyone knows about this normal anion gap metabolic acidosis and high anion gap metabolic acidosis. Here, first, okay, na remember the mnemonic is the rod and run, rod and non-rod. Rod watama, it is rod to watama, renal tubular acidosis, Addison disease, estrogenomida and aldosterone, diarrhea, and GIT. These are comes under the normal anion gap metabolic acidosis, and remaining all that comes under hagma. Nagma and hagma. Hagma means high and gap. That means non-rod. Example, other than rod, iron, alcohol, glycolaspin, lactic acid, decay, they are coming to the hagma. Okay. Next one, Rao. What is the most costly agent? This is the thumbs up sign here. We see the waterma. It is the epiglottitis. The most common cause is the what? Caused by the step pneumonia. Okay, na? Step pneumonia. Remember here, if they ask you what is the most overall cause is the step pneumonia. But if the patient is if the question says that the patient is unimmunized, if the patient is the unimmunized, then you have to mark the H influenza. Okay, or else you have to mark the step pneumonia. This is the stipple sign. This is stipple sign seen in the group, also called as what? The bronchitis. This is caused by parainfluenza virus. This is caused by step pneumonia. Okay, just study this one. You'll get the one MCQ. Okay. This one, I think everyone knows about this one. This is lavender purple color for the routine CBC color. CBC was the anticoagulant we add is the K2 EDTA. For the K2 EDTA, this is lavender color. Gray color for what? Glucose. Okay, na glucose. Additive is the sodium fluoride. Sodium fluoride. It will what? It helps to do not. It will not break the glucose. It will not break the glucose. It is the function of the NAF. Okay, now it will inhibit the glycolysis. That's why this one, guys, will store. This is for the it will for the transport media. We are going to use this one, gray one, for the glucose tolerance for the glucose test. For the going to use the gray one for the sugar test. Okay, light blue here. Okay, remember next one, green means hara, green hara means what? Heparin test. And for the KFT LFT, guys, this is for all this one you can use the red and yellow. Remember from the men one, men A, men one, men two A, men two B. Okay, na men one, what these three pituitary, thyroid, and the pancreas will come. And what are men two A? Patherite, medullary thyroid carcinoma, pheochromocytoma. Meant to be medullary thyroid carcinoma, pheochromocytoma. There is a mucosal carcinoma. There is a mucosal neuroma. Mucosal neuromas. Okay. Remember these are what becomes a men one, men two A, men two B. Remember the Cohen syndrome. Okay, na Cohen syndrome. Cohen syndrome is what? Hyperaldosteronism. This is the primary hyperaldosteronism. There is going to be what? More number of aldosterone. What the function of aldosterone? It causes the hypertension. It means there is a sodium retention. It means more sodium. There is a more sodium. What happened? There is a obviously there is a what? More hypertension. Remember, in the Cohen syndrome, there is no edema. Many of you think that hence there is hypernatremia. There is a hypernatremia. Hence there is going to be the edema. But there is no edema here. There is hypokalemia. I think even knows hypokalemia, metabolic alkalosis, and the low renin. These are ulta is the Addison's disease. Okay, these are all ulta is the Addison's disease. Remember. I think everyone knows about the vitamins ra. Okay, na mostly you have to remember about the assay test for the okay na. Remember for the serum methyl malonate level. It is for what vitamin B12. Okay, vitamin B12 serum methyl malonate levels. Okay. Why? If there is more serum methyl malonate level ra, it's going to what degenerate the myelin fibers of the CNS, and that's why there's going to be the tingling sensation in the B12 deficiencies. Glue test for the what? B9 folic acid, RBC transaminase for the vitamin B6, RBC glutathione drug test, B2, RBC transketose, RBC transketose test for the thiamine. Remember, I think everyone knows about the functions of the all the vitamins. Remember about the XA1A means what? Conjunctivitis, beta spot. Okay. Remember, vitamin C is the most important one. Okay. Scurvy. Okay. Read about the vitamins are very, very important. Next coming to carcinate tumor here, carcinate tumor and the pheochromocytoma. In the pheochromocytoma, remember one thing that this is tumor of what? This is tumor of chromaffin cell. What is chromaffin cell tumor? Look at what? At the adrenal medulla. There is a more sweating. There is what ama? There is going to be more sweating, headache, and palpitation and increased heart rate. But here we have to remember there is no but remember, there is no, remember here, but there is no hypertension here. Okay, there is no hypertension except the only the we are having the palpitations. Okay, only the palpitations are okay. Sweating, headache, palpitation, increased heart rate, but no hypertension here. Remember the screening test is what? 24 hours urine fraction metanephrine VMA level. Confirmation test is the plasma free metanephrine and metastasis with the what? For the MIG-B, MIG-G scan. MIG-G scan, then the PET scan. We'll see the MIG-G scan. What is the management here? You have to do surgery. First start with the what? Start with the alpha blockers here. You have to give the Fmge before surgery. Okay. And in the intraoperative, you have to give the IV phentolamine and the nitroprusside. Okay, na? And also the post-operative, you have to give the labetalol. Okay, remember here, Amma. Remember, before surgery, you have to give start with the phenoxybenzene. Intraoperative, you have to give the IV phentolamine. Post-operative, you have to give the labetalol. For the pheochromocytoma crisis, release of catecholamines during surgery will increase the BP and the hemorrhage and the pulmonary edema. That's why you have to give the Watama nitroprusside plus what? The labetalol. Done. Next one, the carcinate tumor here. Most common site is the what? GIT. Bronchus marker is the chromogranin. Chromogranin is the overproduction of what? 5 serotonin. Okay, 5 HST is what? Overproduction of the what? With the 5 HST serotonin. Skin test is the 24 hours HIAA levels. Means what? This is endogastric acid levels. Okay, this is screen test. Remember here, there is a systemic fibrosis, hepatomegaly. Remember Shiva, systemic fibrosis, hepatomegaly, intestine diarrhea, vasomotor flushing. There is a flushing and there are asthma-like features. Okay. Remember here, there is a rule of third is that 1/3 is the metastasize, 1/3 present with the secondary malignancy, 1/3 are multiple here. Treatment with a surgical resection. So, somatostatin analog example, actotide or tryptophan hydroxylase inhibitors, example, telostat are for symptomatic control. Okay. See here, this is very easy. Read the question here. And repeatedly pressing on the where optic chiasma. See, optic chiasma here, location here. What the problem got? He got the bitemporal hemianopia. Answer the bitemporal hemianopia. Tomorrow, they're going to give the location where location at left temporal lobe. They're going to ask the what is the diagnosis. It is got a right omnivorous upper quadrant defect. Pine the scar. See, this is how they are going to ask the questions. Most part they're going to ask about the chiasma, and also they're going to ask about the this one, right, left, this one sparing. What is the sparing here? They ask the location at the right occipital lobe. It means what they're asking about the then it means the diagnosis will be what? Left homonymous heminopia with the macular sparing. This is what macular sparing here. Macular this ఇలా వెళ్తుంది. Macular this is the sparing of the macular. Okay na? So this is the bitemporal both side here. There is a heminopia. Okay na? So this is how they are going to ask the questions in the exam, guys. Okay, you have to remember. Okay, sometimes they are going to give you just these images only, and they will ask you what is the diagnosis. It is not it means what? All are right side only. It means right occipital lobe with the what with there is a sparing type. Okay, sparing. It's a macular sparing here. This is how they are going to ask the questions. So remember, this is the very important, and this that's it. So guys, I'll continue tomorrow this one. Okay, so we are done with this one. So I will continue with this one from the slide 128 in the other episode. Thank you very much.